Igama lam ndingu-Andile Madondile, ndihlala apha eKhayelitsha eside B kwa-SM63. Uqala kwam ndandigula kakhulu ngo-2004, ndabheka ekliniki. Xa befumaniseka ukuthi okay ndi-HIV positive, ndiyarhalela uba nabantwana kodwa ke eyona ingxaki iyi-1 because of as uba ndiyazi ukuthi itsheri yam yona ayiphili ne-HIV so long because usateste HIV negative yena. So ke ngoku kunzima ukuthi ke ngoku singaheva i-sex without i-condom naye. Siye ndiye ndive kuthiwa ku-expensive ukwenza olaa hlobo lapho whereby kuthathwa khona isperm esi sikatata sithathwe siyofakwa eqandeni likamama without uba thina siye sadibana ngokwesex thina sobabini neqabane lame. Qha kuthiwa kuduri kakhulu. Ndiyarhalela uba nomntana kakhulu uba nomntana, ingakumbi ngondi i-HIV positive. Laa nto leyo indixelela ukuthi okay nam ndizawuba responsible, uyaqonda.
Andile, there are options now for somebody who's HIV positive in terms of having a child. There are techniques that we can use to help you and your wife have a baby, which make it safe so that your wife is not exposed or the baby's not exposed to HIV virus. The main technique that we use to make it safe if a man is HIV positive is a procedure called artificial insemination. And that is where we get your sperm sample, and in our laboratory we prepare it in such a way that it's safe, that we can put it inside your wife's womb and she's not at risk of getting HIV.
Okay, is my CD4 count docs 259? Is it okay to have a child?
It's ideal that a patient has a CD4 count above 200 because it's more likely that they're going to be healthy enough to look after a child in the first place. Okay. In terms of sperm washing, we also know that if the CD count is lower than that, we can have more problems preparing the sample. So I would normally advise patients, if their CD4 count goes below 200, that they first seek help, medical help, with antiretroviral treatment to correct that problem. And then they have a better chance of themselves being healthy, to look after a child, and secondly, a better chance with the procedure.
Okay, I just want to know how much does it cost?
The artificial insemination procedure, which includes the laboratory work and the doctor's fees and the viral testing and so on, altogether comes to about 3,000 Rand for a treatment cycle.
Is there any other, for example, my CD4 count is high now, is 259, and my viral load is undetectable. Can I have a child without using a condom? Because definitely sure I'm going to penetrate to my wife or my girlfriend without using a condom if I want a child.
It's incorrect.
Okay.
Even if your immune system recovers,
yes,
there's always a small amount of virus that circulates. And they've even done studies where people have got very low viral loads, where they've had intercourse and found that you can get seroconversion. So it really is not safe, even if your CD4 count is fine. I think if your CD4 count is good, yes, that's the time that you should start planning a child perhaps and going to see a specialist, but you should do it the safe way.
Ukuba bendinemali bendinokuyenza loo nto leyo, qha ke ngoku ingxaki iyi-1 because ke kuyanyanzeleka qala ndidibene nepartner yam kuqala. Into endiyazi ukuthi andinawukwazi ukuthi ndize ndibe namntana without consulting ugqirha wami. And even i-CD4 count yakho, even if it is high, you need to consult ugqirha before if you want to have a child, because I'm HIV positive. See, I might even infect my girlfriend also, and my child also, she might be infected.
Come in, my dear. Good morning.
Good morning, Dr. Becker.
Hi, lovely to see you.
I'm Nokwezi, boy.
Pleasure. Come on in. Come on in, have a seat. So, Nokwezi, what can we do for you today?
I'm HIV positive and I would like to have a baby. So I want to find out how can I go about into conceiving.
This is a big decision, and I'm sure you're very aware that our worry is that women who are HIV infected can transmit the virus to their babies. And so that really obviously is the thing that is in your mind and what we need to talk about. So tell me a little bit about your HIV infection and also about the relationship that you're in at the moment.
I've been sick, I've lost 2 babies due to HIV, but I only knew with the second baby that I was HIV positive. And though I had a cesarean delivery with the last one, I breastfed her. And then she developed pneumonia at 2 months. And then she just didn't get any better until she passed away at 4 months, 2 weeks. Now I'm in this relationship. Though my partner is HIV negative, he knows about my status, and we're using protection whenever we're having sex.
We're at a point now where you are on treatment for your HIV infection?
Yes, I'm on treatment for my HIV because then I was not taking any antiretrovirals. And now I'm on treatment, and after losing the baby, my CD4 count dropped. It dropped down to 3.
Wow.
And that was in 2004. And since I've been on ARVs, my CD4 count has done well. Like now at the moment it's 309.
What we want in the situation where we are contemplating pregnancy in HIV, the best scenario is a woman who is feeling much better, who is virally suppressed and has a good CD4 count, because that gives us the best option from mum's point of view. Make sure that mum's healthy and strong and able to cope with pregnancy, because pregnancy is a big demand on the body. But more importantly, if virus is suppressed, if we can't really detect virus in the body because either you're on antiretrovirals or you're very early in your infection, then there is far less risk of virus being transmitted to the baby, and that really is what we're hoping for. We want to reduce the risk of transmitting virus from your body into the baby in utero, so whilst baby's still in the womb. And the most critical time is what we call peripartum, at the time when baby's being delivered. That is the critical time when a lot of virus can be transmitted.
At the moment, I'm on regimen 2. I'm taking Calitra, 3TC, and tenofovir.
Tell you the situation with Calitra is that there isn't a great deal of information about Calitra in pregnancy. The most important things are that we make sure your hemoglobin is fine, that you are not anemic, that your liver functions are fine, and very importantly, that your viral load is suppressed. So all of those bloods will need to be taken before you get pregnant to make sure that everything is perfect before you even contemplate getting to a position where you can get pregnant. So we need to be sure that your motivation for having a baby is right, and very importantly, that your partner is on board. So I would like, if possible, to meet your partner, if that's okay with you, and have a discussion with him as well.
Since I'm HIV positive and my partner is HIV negative, if we want to conceive, should we stop using the condom, or are there any other ways?
Because he's HIV negative, it means that semen that he produces will be non-HIV infected, and therefore what we can do is ask him to produce semen, and we can introduce the semen into your vaginal passage artificially. So it's called artificial insemination, and it's a very simple procedure.